Seats. We're going to begin the conference now. And to those virtually, we welcome you, and we welcome those in person to the first ever World Patients Congress of the World Patients Alliance. We are very excited, and I mean very excited, to bring you some great content over the next 2 days, and we're really excited to meet all of you personally. Right here at the front is our board of directors, so we are available to you the entire conference. We'll be here through Monday, so if anyone wants to have a conversation with us, please, let's talk, let's meet. We would also like to tell everybody that this morning we held our members meeting, and we spent an hour and a half together this morning reviewing all of the work of the World Patients Alliance and reviewing our financials and our budget and our expenses, and we reviewed a lot of the work that we've done so far and talked a little bit about the work that we're doing. And we also held elections for the WPA Advisory Board. We have now tabulated all of those votes, so I am happy to announce our brand new advisory board for 2022-2023. In the Afro region, it is going to be Gloria Eknog, who represents us. Emerald is going to be Christine El Ferzili, excuse me if I say the names wrong. In the Euro region, it's going to be Mirjana Babamova. Paho is going to be Migdalia Dennis. And in Ciro, it's going to be JS Aurora. And in WPRO, Greg Lumberiski. So congratulations to all of you. We look forward to working together. And to those who are not nominated, just know you have another chance next year, and we will have nominations again. And we are also enlarging the advisory board for sure. So if you didn't make it this time, please just apply again, and you'll make it next time probably. So with that, I want to again welcome everybody. We have more than 550 participants in our first Congress, and I can't tell you how proud I am of that. Unfortunately, due to COVID and due to some other issues, a lot of people couldn't come. But thanks to our online platform, we're really excited that there's more than 400 people online participating in today's event and tomorrow's event. So it is really my pleasure to welcome you. The WPA is a nonprofit umbrella organization. We started this organization a couple of years ago when a whole group of us who had significant experience in both national arena and in the global arena, we formed this organization with the idea that the patient voice needs to be better represented in all policy and public health matters across the world. And we have actually done a whole lot of work over the past couple of years to ensure that the patient remains the center of all healthcare policies. And we will work to ensure that the patients do have an active role in all stages of their health care, and all stages, whether it's planning, provision, monitoring, research, or evaluation of health services. And of course, there's no cost to join, no cost to attend our conference. And there's a very casual photo of our board at our first board meeting. And we have me over at the left. We have Regina Kamaga from Uganda. We have Carlo Ruiz, who's sitting right here at the table, from Peru. Hussein is online, and he is not only our co-founder and board member, he's also our full-time executive director. He is in Pakistan now. I'll explain why in a minute. And of course, Penny Cohen is right here. She's our secretary and co-founder. And Jolanta Belinsky from Poland is also here. So we are right here at this table at your disposal, and it is really our pleasure to meet all of you. So we have developed 9 principles that really drive all of the work that we do at the World Patients Alliance. Those are access to healthcare, patient-centered healthcare, financial hardship should not be an impediment to getting treatment. We want patients to be empowered, we want patients to be safe, and we want treatments to be of good quality and high quality. We want patients to be educated and informed. We need to have partnerships, which we are developing, and collaborate with like-minded organizations. We need patients to be engaged in their own healthcare, and we need there to be no discrimination against any patient worldwide. All of these are much more ferreted out on our website, so I would invite everybody to go look at our 9 principles that run the World Patients Alliance. So really, it is my pleasure to welcome you to this conference. For those online, you don't know this, but we have no water at the hotel. So this is the new normal that we're living in, isn't it? It's not the hotel's fault. There was a water main break outside, and if anybody has gone outside, you see the entire street is flooded. So for those online, lucky you, none of us have showered today. We've all brushed our teeth with a bottle of sparkling water, and I even shaved with a bottle of sparkling water today. So this may be the new normal, right? But new normal is really what we're all living through, right? And the best example I thought the other night, well, what is the new normal? I thought about our dinner conversations and our family get-togethers, and I thought, look what we discuss now. We discuss a virus, we discuss vaccines, we discuss masks, or in my country, not masking. We discuss politics about COVID. We discuss the impact that COVID has had. Have you had COVID? Have you not had COVID? How many times have you had COVID? Which variant did you have? This is not what I grew up with. This is a new normal. And it affects every one of us, and it affects our families, and it affects how we receive our health care. And so when we were picking the topic this year, we thought this is a perfect topic because this is a new normal that we're living in. This is not the world that we're used to, and it has had a dramatic effect on our health care. Now, unfortunately, you might have heard there's a little problem in Ukraine, and because of those millions of refugees that have come into Europe, the visa offices are completely shut down, and we had 50 people who were supposed to attend the conference in person who couldn't make it because they couldn't get their visas, including our entire staff. So we really tried hard. We pulled every card that we had, and we asked every favor that we could, but we only were able to get 2 people here from 52 people who had applied for visas because there's nobody issuing visas now. So it's really unfortunate, but thankfully we have this great online platform where there's hundreds and hundreds of people who are watching this, and so our staff and all of our members who couldn't make it are watching this live, and we're really excited about that. We have some of the best speakers in the world that you'll hear over the next couple of days representing really important organizations, and you can really get a nice overview of some of those speakers here on this slide. But we really are representing every aspect of the patient journey from development of medicines through the medicine cycle, all the way through the diagnosis and what a patient goes through, and really how can we live in this new normal best, and how can the health systems adapt to this new normal to make patients the center of all healthcare policy discussions. So just a minute on the program. We had our council meeting this morning I told you about, and right after this we're going to hand things over to Penny, and Penny is going to talk about new normal, new challenges. And that panel is going to be so invigorating for you that you're all going to need a lunch right away. So right after Penny's presentation, we're going to break for lunch, and those online can take a break for a little while. And then we're going to come back and do a couple more panels. We're going to talk about what are patient expectations and how can they be met in this new normal, and how can we promote universal health care. And we're going to talk about some of our regional meetings that we have held in Africa and some of the ones we're planning next year. We're going to talk about patient safety, healthcare emergencies, patient engagement with regulators. We're going to have some great panelists on that one. I'm moderating that panel. It's EMA, and we have FDA, who are going to talk about how patients can engage with their regulators. And we're going to have a patient advocate talk about how her organization works with regulators to get patients at the forefront. We're going to discuss digital health, and then at the end, Penny is going to moderate an open forum where all of you get to talk to us about what your issues are, what your needs are, what you would like from us next year. Penny has a whole lot of things to discuss with all of you, so that's where we're going to end things. Now, just after Penny's presentation, which will be next, we would like to get a group photo. So just before we go to lunch, if we could gather everybody together right up here in front of this stage, I think would be a great spot, or maybe on the stage if we could. We want to get a group photo of all the attendees, and we'll then share that with everybody, okay? So right after Penny's presentation, we'll all gather here and then break for lunch. Yeah, that's a good point. I asked the hotel, what are the people supposed to do about going to the bathroom? We have no toilets, we have no running water. And she said to me, well, the men can go outside, And the ladies have to go use their bathrooms upstairs, and don't worry about flushing, the staff will flush it. So all the men to the left outside the door, you can find the natural bathrooms. But this, of course, doesn't happen without the generosity of our sponsors. So we certainly want to thank Johnson & Johnson and Pharma and Intuitive, Sanofi, and of course the Partnership to Fight Infectious Diseases is sponsoring a reception later. So when the event ends, we are going to ask that you stay in the room for the reception. When you come back for the reception, come into the room because we're going to have a very short presentation on antimicrobial resistance. I did it, I said it, AMR. And we're going to hear a very short presentation on how that's affecting every one of us and all of our organizations. We're going to hear what the Partnership to Fight Infectious Disease is doing, and we're going to have about a 2 or 3 minute video that's really compelling that talks about the importance of us all battling AMR. So we thank the Partnership to Fight Infectious Diseases for sponsoring that, and we will then have a reception tonight where all of you can talk and drink and eat, I think, and have lots of fun if we get some water coming anyway. So with that, again, thank the sponsors, and I want to turn things over to Penny, who's going to talk about the new normal and new challenges and invite her panelists up on the stage. Thank you. You gonna sit?
There's no mic there. I'll do it up here.
I'll get you a mic.
No, I'll do it up here. But I need my, can my panelists please come up and have a seat up here, please? Sorry, you're gonna have to sit, there we go.
Oh, do you need your PC?
Yeah.
Okay.
Though it's hard to see, I use.
No,
Hello. All right, well, they're getting that already and sitting down. I'm going to, that's good. Andrew, my water. My water's in. My water's, okay. Okay, all right, I'm gonna do the intros here, there. Okay, so while everybody's coming up here, I'm going to introduce, and if you could just, oh geez, there's steps over here.
She doesn't need steps.
Okay, all right, good. There's nowhere to sit this. I can stand. I'll stand. I can stand. All right, so what I'd like to do, I don't know if there's a slide for this. Aha, okay, so I'm Penny Cowan. I'm the moderator for this, and I'm going to present the first presentation. Oh, okay, so before each one, I want to introduce the panel first, because then we're just, because of the time frame, introduce the panel first, and then we're going to go from there. So the first one, if you could just raise your hand, is Marta, and excuse me for last names, because some of them are a little bit difficult. Don't worry. All right. It's Marta Lomas? Okay. Is a PhD in neuroscience with over 15 years of public health. She's the executive manager of the World Federation of Public Health Associations. Then we have Yolanda Belinsky, and everybody knows Yolanda, I think, is the co-founder of the World Patient Alliance. She's president of the Patient Safety Foundation in Poland and a member of the WHO Advisory Group for Patient Safety Program. And Hussein Jaffrey, who will be online, who is also our executive director, is the co-founder and executive director for the World Patient Alliance. He's the Secretary General of the Alzheimer's Pakistan. He's vice chair of the advisory group of the WHO Patient for Patient Safety, just to mention a few of his activities. We have Roberto DeMiro, is a practicing lawyer and serves as a counselor for the Italian Association of Cancer Patient Coalition and for the Federation of Volunteers for Oncology. And it's in, I think it's in Italian here, but that's translated into that. And then we have Simone Bellegami. Aha, I got that one right. How about that? And she serves on the board of the European Organization for Rare Diseases. And then we have Sarah. Are you not Sarah?
No.
Oh, so you're doing it for her.
Thanksgiving,
Oh, so you're
Alessandra.
doing it instead of her, instead of Sarah?
I say yes. I explain instead of Sarah.
Oh, okay, I didn't know that. Aha, thank you, Andrew. Whoops. Okay, all right. Sarah Alexandra Verducci, and I don't know anything about her because she wasn't on my list, so you are from,
And she just wants to say something.
okay,
Yes,
just,
and I
who is she, where is she from?
instead of Sarah.
Yeah, so
Where-
when you...
Yolanda, where is she from?
Italy.
Just Italy, but what organization?
ANMAR Italia of rheumatic disease.
Rheumatic diseases.
Rheumatic
Okay,
disease.
rheumatic
And
diseases.
She has a shared presentation with me, so
Okay.
you can read this when it
Okay,
comes the time.
all right, sorry about that,
Not now.
guys. All right, so it's time for my presentation. So this is the patient experiences during the pandemic. Okay, so, you know, what did patient care look like during the pandemic? And then I'm going to talk a little bit about my own experience with the healthcare system during that time. The virus had a devastating effect on the whole world and the healthcare system in particular, especially on patients. So, my own experience here. So, right before COVID hit, I actually had to undergo open heart surgery, a surprise to me and everybody else. So, I had 4 bypasses. So, then it was right after that that COVID hit. So, it was really interesting for me. So, I'm going to talk about what changed, how did I access my health care, a little bit about vaccines, about the community communication channel, and then what is next for all of us. So at the beginning of COVID, and I think this really relates to so many people, is the fear, because we didn't understand. We had no clue about and the risk. What are the risks to all of us? We had no idea what any of that meant to us, especially after just having open heart surgery. I mean, I wasn't familiar with that process at all. I had no idea how much at risk I was. You know, so what were my fears? My lack of understanding, and then what were the pre-existing conditions? What did that really mean? And how did they define it? Because I wasn't quite sure how they defined it. And then my basic necessities, and I'm talking about food. You know, how do you get food if you're not going to go out to the grocery store? Fortunately, in the US, we had this thing called Instacart, where you could actually go online, order your food, and within 2 hours, they delivered it to your home. I'm not sure how you all did it, but I really accessed that. And then, like for the holidays and that, there was this thing called Amazon. And so I did all of my shopping on Amazon because that was the only way. I wasn't going to go out at all. It was really quite interesting how it impacted your just everyday life. Things that we took for granted also became obstacles in our life. So the impact on my care had really changed. I had to stay at home because I was afraid to go out. I mean, I was already dealing with one thing. I didn't want anything else. I didn't want to be exposed. But I also was very isolated from my friends and my family. And I remember one holiday we were all on, it was FaceTime. You know, we had this big TV, so we were able to sit there and we exchanged gifts over FaceTime. We'd mailed them out, and then we were surprised when we opened them. We all opened them. It was very interesting how all that had changed. But it's the isolation that was really the hardest thing, because you lost that personal contact with all your people, all your friends, that human touch that I think is really critical to any individual. So, how did I access my care? And I had heard from so many people after open heart surgery that cardiac rehab is really good for you. It was closed. And I thought, well, what am I supposed to do? How am I supposed to? Because I wanted to get as much as I could and get recovered as fast as I could. If you knew me, you'd understand why I need to do this quickly so I could get back to who I was. You know, who do I turn to? Where do I go for my health care? And how am I going to access it? Those were all questions that I asked. Well, and everything was shut down. Everything was shut down. Healthcare facilities, and it was just incredible. You know, physical, all of those things, they were just shut down. No one wanted to see you. Then there was the whole idea of vaccines. And we heard about this. First we heard about, well, they're being developed. They're being developed. Well, when is that going to happen? And then finally they became available, but how do you access those? And so, you know, you'd wonder, where do I fall in this line? So they talked about older adults. Well, I fell into that one. And then they talked about people with preconditions. Existing conditions, thank you. It's the brain. And who was going to receive them, and how safe were they? I mean, I can't tell you how many people I talked to said, we're not getting them, we don't understand them. And then all this stuff talking about, you know, they weren't good for you, they were not safe. And I remember the first time we got a vaccine, we had to make the appointment, and then we stood, even though we had an appointment, we stood in this really long line, and we had to go quite a distance to get it, and stood in the line to get it, and then you have to sit there for like 15 minutes or 30 minutes, depending on who you were, to see, you know, whether you're going to have any kind of reaction, which was also sort of unsettling for me. And then after that, it was, you know, how do you communicate with your healthcare providers? And I remember the first time I was supposed to go see my cardiologist, he didn't want to see me in person. And I'm thinking, I just had open heart surgery. You need to see me. You need to be able to do certain things, like check my blood pressure, listen to my heart to make sure it's all okay. He said, telehealth. That's what we're going to do. We're going to do telehealth. And I called and I said, no, we're not doing that. So I actually made a fuss, and I sort of was able to get it in person. But then many of the other ones worked through telehealth. And I don't know how many of you experienced that, but that was really the way healthcare was delivered for quite a long time. And then there was the time, and I remember logging on, and that was a problem because it wasn't Zoom. It was their own system. So how do you work their system? How does that work for me? It was really difficult. And then do they really understand my needs? Because they're just looking at part of me. They're not looking at all of me. I can remember years ago when telehealth first started, and I was talking to a physician, and they said, I don't like it. And this is what stuck in my mind. They didn't like it because they couldn't really see. They couldn't, you know, listen to them the right way, the mannerisms, all the body language. They were missing all of that with telehealth because you can only see a certain part of it. So I thought, how good is this? You know, how good is this? And again, if you knew me, I needed to get better yesterday, not, you know, next day, but the day before. So, COVID, are you going to be stoic, or are you going to overcome your mask? How do we overcome these fears? How did you overcome the fears? I still wear a mask when I go out to the stores. I don't have my mask on here because but masks are something that people wore for a very long time. And I don't know about you, but I have a hard time breathing with those things on. You can't go into a healthcare facility without a mask on. Try doing physical therapy with a mask on sometime. That's really difficult. It's like, are you kidding me? Everybody has masks on. You know, there's big signs at the door. You can't go in unless you have on a mask. And they have a box of them there if you don't have one, and then the hand sanitizers are everywhere. I don't know about you, but my skin does not like those things. So I have to get out the little wipes and use the special wipes because I didn't have it. But how do you overcome all those fears about? And then you hear about all these new variations of COVID. Is your vaccine going to be good for that one? Is it going to be good for, you know? And we're still hearing about it. I've had 5 COVID shots altogether so far, between the COVID shots and then the boosters. And now we hear they're going to be done every 6 months, at least here in the US, or in the US they are. But, you know, there's always people that refuse to wear their mask. And I think it was on airplanes where they had the most problems. You heard that a lot in the news, where they had a lot of people that had real issues about wearing masks. So, where am I now? The healthcare system has really changed. You know, it's very different. It's a stress system. Now, I've spent a little time in the hospital, and what I can tell you is that the healthcare workers are very stressed. And many of them they have brought in from other countries. Healthcare workers in the US don't want to work. It's been really difficult finding healthcare workers to work, and then of course the mask or no mask for us. You know, that's also been very difficult. Do we still wear them? When do you wear them? When do you not wear them? I know there was one county, I think it was in LA or something, that they put the mask back in for the kids to wear them to school. Boosters, do you get them? When do you get them? Are they necessary? How often are you going to get them? And as I said, for us, it was like now I'm hearing every 6 months, which seems to be a pain in the neck to me. I'm sorry, I don't know about you, but it's just, I don't want to do that. So we don't know what's next. So where's my vaccine shot? Huh. Did I skip it? Ah, I did. So that was one of the things that were really, really difficult. Did I go? No, shut down. I missed the vaccine one. Sorry about that. Availability, who will receive face deep. But I remember the long lines and then the number of people who were really worried about could they get their vaccine. You know, and so it was when do you get it, how do you get it, where do you go to get it. Now you can go to the grocery store, make an appointment, and get them in their pharmacies if they have a pharmacy. Anywhere you can get them. So, but I want to know what is next for all of us with the COVID. You know, what is in store for us? We don't know. I hear, and now the flu season is supposed to be a really difficult flu season. How's that all going to play out with our COVID? We don't know that either. So thank you very much for listening to me. And I don't know.
I think I'm the first.
Are you the first one? So we're going to turn it over to Simone. I'm going to give you this.
Thank you.
And I'm going to hobble away.
Sit.
Yes. Oh, I'm going to take your seat.
So, my name is Simona Bellagambi. I'm here today on behalf of the European Organization for Rare Diseases and the Italian Alliance for Rare Diseases. We can skip all these. I'm sorry. Now it's technicians. We can go, yes. Thank you very much. Thank you very much. So, I've just mentioned rare diseases, and I think that they deserve an explanation because you have to understand how the impact of the COVID was very heavy on everyone. But there are among us vulnerable, more vulnerable people, and people living with a rare disease are part of this very vulnerable part of the society. So rare diseases are defined in Europe as a disease that affects less than 5 people in 10,000. There are over 6,000 identified up to now. So obviously I cannot tell you, that they are all alike, but this is important to understand how it is difficult to understand the needs and the challenge of rare diseases as a whole, because they are so different. But what they have in common is that they are typically disabling, they are chronic, they are progressive, degenerative, and frequently life-threatening. So you can understand, as the previous speaker said, how heavy was the sense, the feeling of fear and isolation that these people could have proven during the pandemic, where they were really isolated. But as I said, not all rare diseases have clinical conditions that increase the risk of contracting the virus or are more likely to undergo a more severe clinical course than common people of the rest of the population. However, there are some diseases, so immunodeficiencies, neuromuscular disabilities, chronic lung diseases. All these are part of rare diseases, as well as the chronic, some more common chronic diseases were considered considered at increased risk. So what Uniamo, which is the Italian Alliance for Rare Diseases, did together with the institution, in this case was the National Health Institute. They conducted a survey at the national level, but the same survey, even though it was in different moment of the pandemic, was conducted at European level among our community. And the outcomes, not surprisingly, were the same. So, as Penny just mentioned in her presentation, we had the disruption of care and the treatment were interrupted, surgery was postponed with a very, I say important, but it's more than important. It's a very heavy impact on the family and on the person. So obviously their level of stress and anxiety was very high, and many people that were in need of rehabilitation were forced to give up these rehabilitation sessions, as well, obviously, not attending school and not having the social support they normally have at home. The information was lacking, so they didn't know how their specific disease was related to the COVID, if they were in a major risk than others. But the pandemic, and I will talk about it later, opened the door to more digital health options. Okay, so this is just to repeat, to highlight actually what I showed before. So the essential treatment of care were severely disrupted for the 84% of people living with a rare disease in Europe, and makes the 52% initially that were forced to give up the hospital treatment in order not to be exposed, and that were advised by their GPs or the doctors at the center of expertise. The disruption of care, obviously the patients found themselves without a point of reference. And as I told you, some diseases really need to go to the hospital regularly. They have to be visited by expert clinicians, as well as the suspension of therapists and the lack of assistance. So these were all the points that are in common with others, but with even a more severe impact on people living with a rare disease. In fact, this led to, in some cases, obviously, to a worsening of the symptoms and a great sense of abandonment and the permanent state of anxiety. So what were the reactions to these needs? Both patient organizations, the National Alliance, and the institutions tried to fill the gap of the lack of information, establishing and conducting webinars, weekly webinars on specific rare diseases. There were regional initiatives. Both were aimed at health professionals and patient organizations, as well as citizens. There were virtual scientific meetings were conducted in order to provide health professionals and scientific societies with information and to ease a sort of exchange of perspective and best practices. The regions, because initially we have a heavy decentralized health system, so we have 20 regions, and this is an issue actually sometimes, and I will explain why, launched a series of action to support rare and chronic diseases, and many helplines were established to provide information and support to the citizens. And there were also many actions that were carried out to support the fragile citizens, especially as regards to the workplace. So they were enabled to work from home. But it is true that this was a big change. So the e-medicine, the digitization of the medicine took over from the face-to-face where it was possible. And so there were some actions that really improved the quality of life. So receiving a prescription via emails or the renewal of the treatment plan via email without going to the hospital, so avoiding any contact, was of big help. And there were a lot of online education tools designed to manage the rare disease. And this is very important to overcome the feeling of isolation that people felt in that moment. The telemedicine were activated, such as teleconsultation and telecooperation, as I said. So what I can say, that the process of digitization of the health system has undergone a strong acceleration during the pandemic, and it was proven that the telemedicine played a central role in guaranteeing the continuity of care between hospital and territory, promoting the communication and the continuous exchange of information between the health specialists and the local doctors and the patient. As in 1 in 2 patients among those who have experienced an interruption of care have resorted to telemedicine. And in this context, the Recovery and Resilience National Plan will play a fundamental role to enhance the process of healthcare digitization, on which Italy still has to make many steps forwards. We think that we need a new legislative interventions capable of regulating the digital health in Italy to achieve an homogeneous level of diffusion throughout the territory, because I told you we have 20 regions, and very often there is a lack of uniformity. So, as you can read, the National Recovery and Resilience Plan will allocate 1 billion euros to the development of telemedicine solution. And the digital development of the healthcare that will enhance the offer of the televisit with patients and the teleconsultation among the healthcare professionals to share expertise. And this is very important for rare disease patients, because the knowledge about rare diseases is scarce. And we have to share information. We have to have expert clinicians that share their opinion. And this will reduce the patient mobility and make available the expertise and the experience of the Center of Experience on Rare Diseases to be linked close to where the patients live. The telemonitoring will be essential to monitor the chronic situation, and the electronic health record. It is since the moment that we are talking about the electronic health records, but up to now it's still too often made up in folders and obsolete CD-ROMs. And the possibility of carrying out various bureaucratic procedures electronically will be a clear improvement in the quality of life of the patient and the caregiver. All this will go together with a reorganization of the health and social care, because we need an holistic follow-up and care. So a reorganization of strengthening of the territorial networks through the establishment of what we called the community house and community hospitals and the territorial operational centers dedicated to patients with a chronic pathology. I want to conclude my presentation giving you a broader perspective on the lesson that we learned from the COVID and COVID related to rare diseases. So finding a treatment for the COVID-19 required a strong and global cooperation and solidarity. And this is the same for rare diseases. The development of vaccines that Penny mentioned before against the COVID-19 in less than a year was a triumph of the science. However, maybe it went unnoticed that the design of RNA vaccines, such as the Pfizer vaccine, owes a lot to innovation in gene editing techniques developed and refined with the aim to find a cure for rare diseases. I forgot to tell you that over the 6,000 rare diseases, only the 4% has a treatment. But also the several decades of extensive transnational research on cancer and rare genetic conditions allowed the coronavirus genetic code to be altered to elicit an immune response providing protection against the COVID-19. In the same way, the experience of the European Reference Network that are our big success because we are collecting the experience through these networks were a good experience on which the European Commission based the launch of the COVID-19 clinical management support system to support the healthcare professionals dealing with the COVID. And this served because it created very quick connection among the healthcare professionals. So I conclude saying that the COVID has also shown how we can improve healthcare coordination and develop impactful and patient-centered care pathway. From now on, we have the unique opportunity to design and implement solutions in policy environment that address the needs of all people, including people living with a rare disease. Thank you very much.
Good morning, everybody. Many thanks for inviting me to this conference. I'm happy to see that the first World Patients Conference is being held in Rome, in my town. I'm a resident in this country, and I'm involved in caregiving since the last 29 years. I'm here as a representative of the Italian Federation of Volunteer Organization in Cancer, FAVO, which was established in 2003 in Rome, connecting nearly all the hundreds of independent cancer volunteers association, which are disseminated throughout the regions of Italy. You heard from the former presentation that we have not just one country from the point of view of health, but we have 21 regions with each one with its own health system. So there was a lack of cooperation among the different realities in this country. And so that's why I helped to draft the statutes of the federation. I am a practicing lawyer, so I'm here in the vest of caregiver. Our federation achieved most of its purposes, exchanging information and good practices among the different realities in the country. improving knowledge, which is essential for the empowerment of the patients. We have an innovative attitude towards the fact that we do not just concentrate on medicine and therapeutical and drugs, but also on socio-economic problems of the families facing the sickness and the disease and the disability. And so we ask for economic aid for the families, not just for the drugs, perhaps because we have somehow privileged in the Western countries of Europe, we have a rather reasonable access to new drugs and therapies. But what was completely lacking 20 years ago was an attitude of social and economic rehabilitation for the families facing the diseases and the disabilities. So the Federation was built to speak with one voice to policymakers, to the government and the authorities, to the scientific societies. 20 years ago, when I first frequented pharmaceutical meetings and medicine meetings, like the European Society of Medical Oncology, ESMO, I introduced myself. They asked, oh, so you're a doctor? Which is your field of caring? No, I'm not. I'm a lawyer. And I'm here representing the patients. And the answer was, patient? What's a patient? In the congresses of doctors 20 years ago, patients were not allowed. So this an attitude which has changed, and it is the best achievement of Patients Association to be heard from the scientific societies, and also the steers of the national health systems, which in Italy is SSN. Every year, our federation publishes a report on the state of cancer patients' care in the country, which is innovatively not focused just on the medical care, but also on the socioeconomic aspects of care. And sticking to caregiving, a study of the year 2012 estimated that a caregiver, a family, informal caregiver for a cancer patient makes your government save up to 20,000 euros because it gives assistance, it gives counseling, it gives transport facilities, it gives helps to the patient, and so helps the welfare system to fulfill its obligations. So I have an experience of 29 years. I calculated that I made my government save more than €500,000 euros. No €1 is given back by the government for this. The problem of cancer families is growing because for sure we have much better results in therapy, so the cancer patients, more than half of the cancer patients are survivors. They face chronicity in their disease, not very often complete healing, but chronicizing the disease and having a rather long life, expecting a good quality of life. So if the population is aging and the population is contracting cancer, the ASCO forecasted that within 2040, 7% of cancer patients will be over 65 years old, which means that there are many positions open for informal caregivers. The caregivers shall be not the parents, but the sons and daughters of the patients and the partners of the patients, which are adult people, working people, so they will have to manage the assistance duties with their employment and their economic responsibility with their own families. Our federation led to the introduction of new laws for the right of the patients and their caregivers. 98%, nearly 100% of adult patients assess that their employment is essential, so we tried to obtain laws and rights to make a cancer patient can go on working. And so we have a law allowing switching to part-time and full-time, for instance. At the beginning, there was nothing about the rights of the caregivers, and now many things have changed. For example, in Italy, an employed person who is a caregiver for a person with a certified disability, such as a cancer patient or a permanently disabled person, is allowed 3 days per month of paid leave, which is a very important law and right, because you must imagine that at the European level, the Work and Life Balance Directive asks the government to allow 5 days per year of paid leave for caregiving, which is nonsense, because there is nothing you can do in 5 days of your life. So Italy is an advanced country in this field. We have 3 days per month of paid leave. Further, 2 years of paid leave, which a caregiver can spend in his own labor life. A caregiver has the right to choose the site of his employment, whenever possible, is exempted from night work, and has priority in switching his job from full-time to part-time. And this is namely an achievement of our federation in its lobbying action with the government. Nevertheless, 40% of the employed caregiver refer a detriment of their economic condition. 6% refer severe detriment of their economic condition, such as complete dismissal from the job. This was a study published in the report on the state of cancer patients of last year. What's next? There is still no law provision for pension rights for caregivers. There is very few and poor carers support programs, and there is no protection at all for the self-employed caregivers, because all the laws we have protect the employed persons, but not the self-employed, for which the risk of economic disaster is very high. What can we learn from the lockdown, from shutdown or lockdown? In Europe, we say lockdown instead of shutdown, but the same is the COVID-19 changed many attitudes in our health system. Some was a positive change because smart working, the diffusion of smart working makes easier the caregiving for an employed person. So we hope that smart working remains as a good heritage of the COVID pandemic experience. Now we have just provision for the fragile workers, such as sick and disabled workers, but not yet for the caregivers. So return to work in the new normal will be challenged by the fact that the shutdown delayed the screenings, delayed the eligible surgery, and so we are going to face poorer health conditions, an increase of difficultly curable cancer due to the suspension of screenings. And so this will increase the disparities in access to care and the social disparities for the families. But we also know that poorer economic condition leads to a worse prognosis. There are published studies showing that there is a financial toxicity, the fact that when a family faces cancer, if the family has a severe detriment of their socioeconomic condition, also the prognosis of the patient will be worse. We have some new laws to face the new normal. For the first time, informal caregivers were acknowledged by the law since 2018. And there is a very, very small budget from the government for the needs of the caregivers. which is a ridiculous part of the gross domestic product in this country. So as patients and caregivers organization, we were somehow happy to know that there is a legal recognition of their role, but there is offended by the very small amount of money devoted to this assistance. Italy is waiting to adopt a new national cancer plan. There is a strict indication from the European Union. Resources shall be devoted to rehabilitation and to helping caregivers. Member States must draw a national action plan to make care available, accessible, and of better quality, also supporting informal carers through training, counseling, psychological and financial support. Lastly, there was a view adopted by the United Nations Committee on the Rights of Persons with Disability this summer, stating that Italy is under a duty to provide empowerment training to enable persons with disabilities to live independently and to support family caregivers. Thank you so much.
Good afternoon. My presentation a little bit repeat what my previous speaker told, what we had in this difficult COVID time, and I will more concentrate on the patient role in the new normal. Just a second. I took some information from our ombudsman in my country, in Poland, and this ombudsman is a person who collects all claims from patients. And just only to go through, because it was similar in all European countries. That patient during COVID had extended this waiting time, that they had, very, very big difficulties to reach a medical records, because for every day I am also a deputy director in a city medical center, biggest center in my city in Lodz. And during COVID, very luckily, I had no COVID. I had COVID last summer after 3 doses of vaccination. But that time, in hospital, I was really nervous because people couldn't reach the special department to receive, to collect the records, to give to other consultancy doctor. So it was a really poor situation. And this closed wards, closed hospital at all, it really bring a lot of problem for patients. Another complaints were about the functioning of primary care, because people couldn't go to the doctor face to face. In some hospital, like in my, we never stop to take patients. So we were overloaded with crowds in every room, because it was the only hospital who took every time patient, and we tried to keep this distance, 1.5 meter, mask of course, and everything. But the time for waiting for specialists during COVID, it was also very, very long. What we had also difficult, because it was a limited access to diagnostic. So to make ultrasound, to make any diagnostic, it was really long time to wait. And patient also noticed that the behavior from the medical staff was not always properly. So they were an ethic problem, but doctors were angry because they were overloaded with work, but then this all stress and all bad emotion, they transfer many times to patients. What also moved me, my hospital, as the biggest hospital in the city, has not only wards like neurology or internal ward, but they have also special more than 100 places for senior people. You know what senior people felt during pandemic? They couldn't see for more than 1 year their families. Not all, you know, these people with 90, 85, they are not using a mobile. The nurse didn't want it to take a patient to the phone, so the family couldn't reach, even with mask and with COVID test. They couldn't just see if they loved the family. So these old people had a feeling they are alone, they don't have family. So for me, it was the most moved time in pandemic, because people on surgery or people, young people, they communicated via Skype, via mobile, and it was not a problem. But this refusal of personal contact, it was really, really a disaster. What else? So as I told, they were complaining about this not visit, and what else? Now we change the situation. So in new normal, we differently see now care, because people during 1.5 years adjusted that you can not always have a face-to-face visit, but sometimes to have just a prescription or just to have some information about the health, you can just call the doctor, and the doctor can call you. For some patients, a virtual visit represent already greater convenience and access. It is very convenient sometimes for older people, for people who doesn't have weak communication via phone or via computer. So this is for these people who are in advanced technology, in good condition. In new normal, we have also a new strategy to eliminate unnecessary visit and healthcare cost. We can reduce travel time and burden for patient. But this is, of course, a new normal, but for some consultancy, as my previous speaker told, sometimes it's very important to know the body language, because if you call the doctor, yes, you have the prescription, which medicine you take, how much you take, but sometimes if you see a doctor in person, the doctor see you have added some kilogram, or you are slimmer, your eyes looks not so good, you just need this and this new diagnostic. So that's why in new strategy, of course, we accept more visits which are virtual, but we cannot avoid a personal visit at the doctor. What is also important, patient access to important point of care, testing, vaccine administration. It is also extended using mobile health clinic drive-through sites, and school based on health centers. Nowadays, it is also very often that we have some small devices, oximetry, blood glucose, so we can do it every day, and sometimes you can even be joined to the medical center that cardiologist or diabetologist can see your results and can react in proper way when something goes wrong. What is also good now via COVID has changed even psychiatry. So before, nobody could expect psychiatry consultancy could be present via computer or via mobile, but people needed this help, and that's why they adjusted that sometimes they can have also a visit not in person but with therapists via phone. We also preparing for new normal post-COVID, hospitals, promotion of health, appropriate materials for patients, because we know we need to be prepared for every unexpected situation which could happen. So pandemic has changed the concept of access to healthcare. Telemedicine, you know, I remember 10 years ago, I was on any presentation and I told that telemedicine, yes, I was in Afghanistan in the base during the war, and that time it was an American hospital there, and they did operation with the hospital from New York. So the surgeon from New York asked exactly what should do this doctor in Bagram base, and it was for me like, oh, this is like Alaska or Canada. They don't have access to primary care, to consultancy, so they need this telemedicine. But now what happens? Telemedicine came after COVID to our houses. To some of us use now the telemedicine very common. So this telemedicine is delivery and facilitation of health and health-related services. What we need for this? We need a patient education. If we need a patient education, we need to understand that patient alone cannot do much. So patient organization, like What Patient Alliance, or like your local organization, you support all patients with information, you teach them. Even a clinical trials, it is this consent form for everybody looks so strange, but if we explain every point, if we tell the patient you can resign in every stage, on every moment, he is more aware. Like the professor, doctor, lawyer, our lawyer told before, we need also to know the law, because if we explain what are the rights of patients, what are the obligations, they can really better function nowadays in this new normal. They can also have better understanding about self-care. Till now, people understood, oh, self-care is only if I buy something OTC in the pharmacy, any syrup, or I have a painkiller, so this is. But now, self-care has changed. So every patient and every organization needs also to teach people how to use this self-care, because self-care gives us opportunity to be more empowered about and more engaged in our health. So we need this medical institution. We need to give access for elderly population to resources via smartphone, via organization which exist in the world. So what is the role in this new normal for our governments? So they need to develop norms, regulations, standards, And what is important, patients should be included in this process. So they need to give some advices. You know, if some institution in Europe announce, oh, please bring us patient groups, they need to recommend this or this medicine. This is very good, but sometimes they don't collect a proper information from patients. Only patients know if after this medicine he will feel weak or he feels that he cannot go to work or cannot take care of children. So that's why first step is to educate patient, to collect this information, and then bring to institution, to policymaker, to governments. This is also important to build partnership with healthcare providers. Government should provide workforce capability, upskilling to support virtual care, and ensuring data security. This data security in Europe nowadays is very strange, and everybody knows that it's sometimes difficult to reach any information because they just protect data protection, say to us. So as I mentioned, self-care is a sign of new normal. So a patient is autonomous, independent person, and he needs to be involved in this patient-centric care and collaborative care with the doctor. What we also want to do as World Patient Alliance, our dream is that every patient is an expert patient, that the patient is empowered, that the patient can decide about the care, that the patient really play an active role and is well-informed. And we start maybe such program soon. We do a lot of webinars, and I hope people who attended these webinars, they are happy because they are a lot of important information which we can transfer further. I am also happy that today I have a chance to invite a person from Italy. I was very happy I appreciate LinkedIn, because on LinkedIn some people from Italy told me, oh, Jolanta, I saw you 10 or 12 years ago on any conference, and now I will come to this World Patient Alliance conference. So I invited also Sara Severoni, but instead of Sara will come Madam. Yeah, yes. And she will present what expectation had just this organization in Italy. So I give you the floor.
Yes, thank you. Thank you. As we said, my name is Alessandra, and I'm the president of one of the umbrella region that collaborate with Anmar Italia Onlus. Our organization is alongside people suffering from rheumatic disease since 1985. As we say, our national association is really a federation of 21 presidents of independent no-profit regional. We count more than 20,000 members of all regional. We are not only unsaid patient, but unfortunately also a lot of young people that suffering with the rheumatic disease. And we have also a young group. We are the only Italian that work in Euler Pare and Euler Young Pare. That is patient work association. And yes, and we work side by side with the European scientific rheumatologist, known with the name, with acronym like CIR, CREI, EULAR, and healthcare professional involved in the management of rheumatic disease. Our mission is to protect patients with rheumatic disease, not only as in a healthcare position, but also educated them, the family, the caregiver, and also achieved in their rights. During the COVID-19, we collaborated with the patient association and each local healthcare. And we did it as to guarantee the access of medical treatment over entire regional territory. We supporting patients with multi-chronic symptoms about possible side effects and anti-COVID vaccine may have with their daily treatment. We have also supported rheumatologists and in Rieti ASL, the local health service in programming the program patient vaccination. We accompanying also the patient to access hospital care, enable and maintain their therapeutic plan. We also following up of COVID and non-COVID patients through the telemedicine and remote assistance. The doctor-patient informative through the webinars. We organize also online coursing in physical rehabilitation and psychological support because of the isolation, the new isolation of the patient. We use the QR code to target information about pills to be about the safe medication. And we take in seminar also COVID-19 antigenic screening as a preventive therapy before receive in medication at the hospital. And we product also a short film and we share on the website during the famous platform that all use on social media to approach the young age and and the comic about the best practice to manage the disease. Also, young reality in Europe. Monthly, we have a webinar through Italian organization. Each president, the reference. I'm also the reference of EOLAR project. And we organize many webinars about various topics of rheumatic in people. And we support them to use social media to raise awareness about RMDs in young people. We joined also task force project to present a young point of view. We create many social media campaigns to raise awareness about specific topics. We've made a live streaming about relationship between mental health and MDs. We're joining also research and project to make a young voice heard. And at the end, we have many of us, we know what learn in the COVID disease. After COVID disease, we learned special things not always speaking about, to be a group. We understand that one only person on one only group or one only organization by themselves can do nothing. We understand that collaborate together, to be empathic and to support each other is the most way to run. I would like also to speak about the name of Assunta De Luca that have not to be here. and is a precious collaboration because she is the director of ASL Delegates, that she would like to enjoy, but unfortunately she couldn't. And she's a very, very important to make in touch the healthcare professional and patient association and make a good job. So I give the message from her, and I thank you all to invite us.
So it's my pleasure to give you the last speech of this morning, and thanks for being invited here. It's really an honor for me to discuss with the patient about the role of healthcare stakeholders. Are we ready for the new normal? So during these 10 minutes, I would like to discuss and to find an answer together with you to these 3 questions. Who are the stakeholders? What is the new normal? And how can we equip stakeholders with skills and tools to face the new normal? First, who are the stakeholders? While I was preparing this talk, I felt a bit uncomfortable about the title I was suggested to adopt. That was about healthcare stakeholders. The health professional families is much broader than that. Healthcare providers are key. But we should not forget that public health professionals are as important as the care providers, because those professionals work, let's say, in a very silent way to prevent the disease. And public health has been the invisible guardian of our health and well-being for decades. And in many countries of the world, we have taken for granted access to water. Let's say today, I have some doubt here, but let's say access to water, access to safe air to breathe, access to safe food, but also all the screening, vaccination, all the primary prevention that we are offered for free and we give for granted. So I will focus my presentation on the role and the skills needed by the healthcare and public health stakeholders, but I want to drive your attention on the need that we don't need simply stakeholders, we need leaders. And we need leaders at all levels. During the COVID pandemic, we have seen a lot of health leaders discussing with politicians, try to convince them to take unpopular decisions like the lockdown, and to bring all of us out of our habits, our comfort zone. We have some leaders like this. We need much more. But it's not enough. We need to recognize that we need leaders at all levels. So to reach the point we are able to convince a policymaker to make a law, we need to start with data, with accountable data. So we need leaders that collect those data. And then we need leaders that translate those data into information that can be understood by communities, patients, other stakeholders, and can be transmitted on different platforms. We need leaders in communication. And then we need leaders in education that empower the communities, the patients, the stakeholders to drive their activities in the best possible way. But even if we do that within the health sector, this is not enough. We need leaders outside the classical health sector. We need to understand that other professions like lawyers, like engineers, architects, and many others are part of the health family because their actions have a huge impact on health. And so we needed to not only understand, but create a sense of respect and of trust and of recognition of the role that all the different professionals has on impact. And it is not easy, because we may be asked to have less privileges, less recognition, and we need systems to be put in place so that with incentive, laws, and innovative approach, we can have all a seat around the table where important decisions around health are taken. So we have answered to the first question, who are the stakeholders? Now we need to define what is the new normal. So we live in a world that is characterized by crises, a lot of crises that are global, with no borders, very complex and interlinked. Just to cite a few, the COVID pandemic, the climate crisis, just see the floods in Pakistan a few weeks ago, war and displacement in Ukraine, just to cite the closest one to Rome, but we have many in the world, political instability, social and economic insecurity, lack of human rights and dignity. See what is happening in Iran, for example. And all that has an impact on each of us. But the impact is even more important on the most vulnerable and on the patient too. So we as health professionals are in a very complex situation. We are living surrounded by challenges. Innovation and technologies are bringing incredible increase to the health of patients, to the activities we do at the community level, but can be also very destructive, especially when we think about communication. Also, we live in a world where the trust in science and in health professionals is less and less. And we observe a politicization of public health decision and a globalization of health threats. So, in this new normal, how can we equip, and we reach to the question 3, how can we equip the stakeholders with the skills and tools to face these new challenges? Many skills are needed, but I will try to focus on those that, for me, during the COVID pandemic has popped up as the main skills that we are missing. First, communication skill. Ability to communicate on media, social media, but also to communicate risk and science. And to discuss at different level, community, patient, other stakeholders, journalists, influencers, and policymakers, because we need to work all together if you want to make an effective advocacy and make a change happen. And very interesting, this was suggested several times when discussing with cancer patients, we need healthcare and public health professionals that are empathic, that are able to understand the situation. All these skills are needed to engage more the communities. It is something that is not done enough. Community, patients, and all that to create a trust. And we need skills to work with the other sectors. Of course, we cannot be experts of all the sectors, but we need to be able to understand the impact of other sectors on health and have skills to collaborate with them. And more than ever, we need to be flexible and to adapt ourselves to the new reality, to the new challenges. We are not out of the crisis today. We will not be out of the crisis tomorrow. More crises will come. We need health sectors that are able to adapt as infrastructure, approaches, screening, and human resources fast to the new realities. And more than ever, we need to be brave. We need to make the leaders accountable for the impact they have on health, for their choice. And even, of course, it's a kind of very difficult proposal, but think about maybe making public health malpractice as a crime against humanity, as we have in other settings. And before ending my talk, thank for the organizer to allowing me to say that all these debates will continue next year, again here in Rome at the World Congress on Public Health. And I will invite you all to attend and to submit proposals to present your experience and to share your needs and your ideas. Thank you very much.
It was our last presentation, but I have a big request to all of you just before we go for lunch. We would like to make a family photo. Every of you will have a souvenir from Rome, all of us. So please come to the stage because this is a very nice picture. I hope you like it. So we like it and we do with our chair. Everybody, we can stay here and somebody will make a photo, professional photo. Thank you. Come. And after I invite all of you, of course, for lunch. After lunch, we meet again here, 2 o'clock. Yes, Chair? Lunch is in the same place in the restaurant where we had breakfast. So this is only for us lunch. I promise you a real Italian food. So everything is fine. Yeah.
Yeah, the lunch is, when you go up the stairs, you keep going straight, and it will be directly across the hallway, straight at the top of the stairs. Lunch is included. We have the whole restaurant to ourselves, and then you return here at 2 o'clock for the next panel. To those online, if we're still with you, please come back at 2 o'clock. We will continue the panel discussions at 2 o'clock on the new normal, what patient expectations, how can we meet patient expectations? So please return in about an hour. Thank you all.
The last speaker gave 7 minutes. The timer is really off. You need to talk.
That timer's on?
Yes.
Oh,
She only got 7 minutes. She said I'll stay to 10, and when she's on the time, she gave it to 7.
good, good.
But that's not the point. The point is, they gotta fix that.
That was a long panel. I think that was the
Because
longest panel.
They didn't pay attention to the time.
Wow, look at all these people.
I do. Oh, they couldn't find it, so they were like, who are you? Anyway. Thank you. Thank you. It's good to be here. Yeah.
Thank you.